While addiction can happen to anyone, the developing adolescent brain is especially sensitive to the toxic effects of substance use. The most common substances teens use include alcohol, nicotine in vapes, cigarettes, and chewing tobacco, and cannabis, also known as marijuana. Using pills is also common and can be especially dangerous because pills purchased illegally may be contaminated with fentanyl. This dangerous chemical can cause death even in small amounts. What are the risk factors for substance use disorder in children and teens? People whose close family members have alcohol or drug use problems are at higher risk, both because of genetic risk as well as environmental factors. As the number of relatives with addiction that a person has increases, so does the risk that person will develop their own substance use disorder. Genes can't be changed, but there are some things you can do to lower the risk. Unlike family, friends and activities are chosen. Friends can influence the choice to start using or not. Starting to use one substance, like nicotine, can lead to others, like alcohol, cannabis, or other drugs. Another factor is age. Almost everyone who becomes addicted begins using drugs before they turn 18. Research shows the younger a person is when they start using alcohol or other substances, the more likely they are to develop a substance use disorder. Social support is also important. Supportive adults can serve as role models, listen to concerns, and build connections so they'll be around and aware when help is needed. A young person's emotional well-being can also help determine the chances of developing an addiction. Are you worried your child might have a substance use disorder? Here's what that looks like. There are some signs to look out for when it comes to teens and substance use. And it should be noted, if you already suspect there's a problem, you're probably right, because by the time substance use comes to a parent's attention, it's usually been going on for a while. If your child seems more socially withdrawn, irritable, or moody, that's a reason to take notice, although those issues aren't unique to children and teens with substance use disorders. You may notice the smell of alcohol, smoke, or cannabis on their clothing. There may be a change in the way they dress. You may find alcohol, drugs, empty bottles, or vaping pens or oils around the house or in your teen's room. Other potential warning signs are a loss of interest in hobbies or the introduction of a new friend group. As a substance use disorder progresses, a child may isolate themselves from family or friends or become secretive. Likewise, they may ignore schoolwork or skip classes, and their grades may drop. These are all indications that something is wrong, even if it's not related to substance use. If you see any of these signs, speak with your child's primary care provider. Mental health disorders and substance use disorders tend to go hand in hand. Teens who experience depression or anxiety are more likely to use substances and develop substance use disorder. While teens may be using substances to help manage their moods or anxiety, reduce stress, or increase concentration, substance use makes underlying mental health disorders worse, and in some cases can even trigger them. What can you do to help? Talk to your children about substance use regularly. Invite them to join the discussion, ask questions, and practice ways to keep up a healthy lifestyle. Although it can be hard to start a conversation on a difficult topic, it's best to start talking to your kids when they're young, before they ever have the chance to use a substance. You can start these conversations by pointing out ads for alcohol or vape shops you might see in your neighborhood. Watching a TV show or movie with your kids and seeing a character drink or smoke is also a good way to start a conversation. The preteen doctor visit is a great opportunity for doctors to provide guidance to parents and children. Screening can help figure out if your child has started using substances and whether they have a substance use disorder. If there's a problem, a brief conversation with a healthcare provider can also encourage an adolescent to accept a referral to treatment. Most teens with substance use disorders can be treated as outpatients. If more intensive care is needed, the appropriate level of treatment depends on availability, insurance coverage, and a family's preference. The bottom line is that substance use disorders can be addressed. Keep an eye out for signs of trouble, talk to your kids about substance use, and don't be afraid to ask help from medical or mental health providers if you suspect a problem. Boston Children's Hospital is committed to keeping children and adolescents healthy. If you're concerned about the impact on your children, please speak with your primary care provider or visit bostonchildrens.org.